Let's bring you to this story now. The Public Protector's Office has given the Eastern Cape Health Department 90 days to act against officials responsible for the 2020 scooter project. Releasing a report on the project, the acting Public Protector, Kollega Kalega, said the ambulance project did not follow due processes. She says the procurement process contravened legal prescripts and was improper. Now, the department purchased the motorcycles for 10 million rand in 2020 to serve as ambulances that could reach remote villages with poor road infrastructure. Well, for reaction to this now, we're joined by the Eastern Cape Premier, Oscar Mabuyane, who talks to us all the way from East London. Premier, thank you very much for your time. So, as per that introduction, 90 days is given to the Health Department to act on the officials in the Supply Chain Management Division. How soon can this be carried out?
Thank you very much, Tole. Good morning to you and good morning to viewers. Soon as possible. Soon will be your 90 days maximum. We can't wait for 90 days. We should be acting on the report with clear remedial actions. We welcome the report as the provincial government, and you would understand that we called for all these kind of investigations, including the SIU, ourselves, when these issues were actually out there in the public. We got the SIU report already, we actioned it, and now we have received the Public Protector. What we like about all of them, they affirm our view as provincial government that there is no money that was spent here. So not a single cent was spent here. The issue was about a process which is being disputed, how these investigations are actually outlining it. So it's really an issue of supply chain. So definitely, I think we are at an implementation stage now of outcomes. We can't really be opening up the reports, etc., unless there will be individuals affected who will feel otherwise. And from where we are going to be implementing the report. We are welcoming the report, and everyone was given a chance to explain his or her side of the story, all those who probably would have been affected. So we are welcoming it, and we'll deal with it and be clear on what must be done by the HOD, on what must be done by the MEC. My work as Premier will to make it a point that the MEC in the department action the report as soon as possible.
Yeah. Premier, it obviously is good news to the ears of the public, in particular taxpayers, that no money actually was spent on this scooter project because of the process that was followed. In future, or should we say going forward though, do you still think that those motorcycles are the preferred way to transport elderly patients who are in far-flung areas of the Eastern Cape to try and bring them to healthcare facilities in cities, if you like? Are they still the preferred mode of transport?
It has never been our idea to use the scooters to transport elderly people or sick people from rural areas or wherever. We do have ambulances. We have been actually procuring ambulances. Even last week, we were handing over about 98 ambulances. It was not for the first time in the last financial year. So we were to use scooters in terms of the concept itself. We were to use those scooters for our primary health care and removing the elderly people who are in queues in hospitals collecting their medication every month to deliver those medications. You remember we've got a number of people whom we call the primary health care workers and those community healthcare workers who are delivering medicines to the doorsteps of our people. This is what is done in the urban setup. Medication is delivered through bicycles and motorbikes, even those who are using the missed delivery services. So we were looking at that as part of us clearing the queues in our hospitals and our community healthcare centers or clinics. So the idea remains relevant from where we are. We have never had an idea of transporting elderly people to, in certain rural areas where it is so difficult to get in the ambulance, moving a person from a household instead of using the wheelbarrow or whatever, and that could still be an ideal situation. So we were basically repurposing. The idea was about repurposing those motorbikes because of the COVID situation and how you deal with that even inside hospitals, etc.
All right. So Premier, let me get you clearly then. Let me get you clearly then. So these motorbikes, this is a contract that you may still consider going into the future.
I lost you completely at the connection. I'm not sure what's going on.
All right.
Can't hear you.
Premier, can you hear me now?
Yes, I can hear you now. Yes.
Okay. All right. So I'm simply saying to end the conversation around these scooters, are you saying that these scooters may be a project that you may want to consider in the future, this particular contract?
Not necessarily this contract. If the contract was flawed, remember, we stopped this ourselves as provincial government, particularly me as Premier. When the matter was brought to me with all the issues, halabaloo, around it, I instructed the department not to pay anything and stop that. So all other people who came in later to pursue investigations and all other issues, including the tribunal, which was asked by the SIU, came in when we have stopped everything to ensure that no money is spent, no money is paid where there are issues that are being raised around a particular contract. So it's not about a contract, it's about a concept, it's about idea. As we move to the NHI, you need to look at all the broader views and creativity around that. So in the areas like where we are in the Eastern Cape, we definitely need that kind of service. Our older people are still going physically to hospitals just to collect their monthly medicine that they are supposed to, all those who are chronic. So what we're saying, yes, we have people who are moving long distances in rural areas delivering those medications. We've got to find the best way. But if the procurement was wrong, it then therefore nullifies the contract itself. So the concept, the idea remains relevant, so it could still be looked at as we move forward.
Premier, then let's again look at the issue of disciplinary action. You're saying that 90 days may probably be too long. You need to act, and you need to act with speed. But there are those who say, we don't really trust you. And the Democratic Alliance are actually the party that have said that to us this morning, that you still have the person whom this process to procure these motorbikes was conducted under. That's Dr. Thobile Mbengashe, who was the head of the health department at the time. He has now been shifted from health to be a special advisor in your office. Do you see why there is a trust deficit?
Well, I think that's just a mischief from the opposition. While DA is an opposition, the issue is SIU came out when Dr. P. So we acted on that. Even on him, we are still pursuing what was raised in the SIU report. There's nothing that is going to stop us on this. They know it very well. We have put up a system on consequence management as this provincial government. We've got to stop all the wrong things that we're seeing out there that are continuously going perennial. We've got to stop that kind of a behavior. So if there are remedial actions, will be done. Public protectors said within 30 days, the department must submit a plan on how it is going to action this. So that will be done. For me, it's not to wait for 30 days. The plan can be done within a week or so. We can't really extend it to 90 days when we know we've got to act and deal with these issues. We've got to deal with distraction in the system and focus on real issues of providing a quality healthcare service to our people. We can't be stuck about implementing reports of investigation that have been done and concluded. This is our attitude in the sixth administration. No report is going to gain dust in a shelf being unimplemented. We are going to implement the reports. That's our commitment. We are trying our level best to ensure that we uproot all the malfeasance in the system, deal with the real issues, focus on hardcore issues, so that we are not diverted by perceived issues that people are raising. Opposition will remain an opposition. They will always throw everything from an opposition point of view. So we accept that and wait and see. We have done it, and we are going to continue doing it.
All right. The Public Protector also recommending that the officials, the managers in the Supply Chain Management Division should attend a workshop on relevant legislation that deals with the procurement of goods and services, and this must be done within 60 days. That should come as an embarrassment, though, Premier, that very senior officials, their knowledge of what needs to be done is suspect in matters of procurement. Surely that must embarrass you.
Well, of course, it is an embarrassment, but I don't believe that that's a real issue. Those people have been procuring there, they've been here for years. I wouldn't even know them. I just came into government. Those are senior managers, chief directors, directors in the supply chain. They know the laws. And even in this case, they would have followed a particular law under emergency from 21 days, the prescribed procurement or supply chain process into whatever 9 days, what that would have been recommended at that point under the emergency procurement. So the issue is there. So we don't want to discuss that. And now the issue is at the point of implementation because it has been investigated.
If
those officials were given a chance
Premier,
to go to explain.
I'm sorry to cut in.
So,
let me interrupt you there, Premier. If they know the rules, if their knowledge of procurement processes is not questionable, then what were their intentions for subverting the very rules?
Well, that's what the public protector is picking up as the weakness from their part. This is what we will hear in the process of the disciplinary hearing, because we've got to act on that. That intention will then be explained by them. I can't speak about it because I wouldn't know the intention. The issue that we only want to see is supply chain that is actually immune from all these other interferences, and we don't want other people who are not meant to be involved in the supply chain to be involved. So we will leave it there. Those people will still be given a chance in terms of the remedial action to answer for their side of the story. So I can't be speaking on that and speculate around that issue now.
Premier, then let's talk about what the Auditor General told the nation yesterday, and that is that your province has the highest unauthorized spending in the country to the tune of 1.59 billion rand. How are you turning things around in as far as maladministration, Premier?
Well, it has been our view as the sixth administration since we came in that this issue of irregular expenditure, wasteful and fruitless expenditure are as a result of poor planning. We have been hounded here by the historical challenges. These issues have been endemic or systemic, and we are trying to deal with that. We have developed our system to respond to this issue of audit improvement for all departments. This comes from the previous historical issue that comes from the Department of Public Works and Education and Health to a larger extent. It's a 19 to a 20 financial year, but it dates back. These are issues that are coming from many other previous years. Okay. This issue of irregular expenditure. We are dealing with that, and we've been reducing that because we've put in a system in place that deals with that conduct, and we've made it very clear. The only thing to stop it is to really implement consequence management so that people who are supposed to be doing these things and implement appreciate that it's important that you stick to the law so that you don't do all these funny things of rush on the last minute. You plan properly. If you plan properly, you will spend accordingly, and you'll be able to monitor your spending patterns, and you can't have a situation where you talk about irregular expenditure, etc. Irregular expenditure doesn't always mean that there's corruption involved. There are cases where irregular expenditure has been authorized itself. And if that process has been followed to the latter, through the provincial treasury or national treasury, that issue will always be regularized at a particular point. But we have been reducing. In overall, the provincial government has improved in the audit outcomes because of the audit response management system that we put in place. So we've got our own audit outcome response team with Treasury that is monitoring every department to make it a point that we address this chronic problem. We can't continue living with it. It actually distorts, it actually creates this negativity that is out there it actually affirms the idea of corruption. Immediately people speak about irregular. They literally interpret it into corruption. Irregular means irregular. It's not something that must be done, but in certain cases, it is done because of certain different conditions that would be explained in terms of the law. We don't want it. We don't want wasteful. We don't want fruitless expenditure. We want people to focus. Managers must manage. Leaders must lead. Have our government clean and dealing with corruption wherever it actually shows its ugly head.
All right. Premier, can I ask you kindly to just sit tight where you are when I take a breather? When we return, I'd like to ask you about the adjusted regulations around COVID-19. Very good morning to you once again. If you're just joining us, we are in conversation with the Premier of the Eastern Cape, Oscar Mabuyane, on the back of the reports by the Auditor General and the Public Protector. But, Premier, I want to shift the conversation now to COVID-19. Your province was the first to be hit by the second wave. What's your attitude towards interprovincial travel? Because your province seems to receive a number of people who work outside the Eastern Cape and who migrate during the periods in the country where we go into short holidays. Are you worried?
Yes, but of course we are worried. It concerns us a great deal. But even from the alert level 5, as a province, we've never had this really lockdown. All these other alerts, because of exactly the same the factors that we have spoken to. We are a labor-sending province, and our people in numbers are staying outside the province. Every weekend, if you look at Western Cape and us, you have got the traffic that comes back home for burials and other things. So we've never had that. We've never stopped people burying. So we had all this movement happening from the alert level 5 until now. It has been concerning us. It has been a contributing factor in actually spreading. That's why we were clear that the funerals are super spreaders. They must be regulated. So even now we are concerned, but we've been making an appeal to our people to take responsibility. But since the introduction of these non-pharmaceutical interventions, the mandatory wearing of masks and keeping social distancing and the regular sanitizing or washing of hands, staying at home, we have seen that quite effective in mitigating this challenge of spreading the virus. And as long as our people move around, the virus moves, because it moves with people. And with it making that play, we have seen terrible things from alert from phase 1. It was worse in phase 2. And exactly at this period, during the Easter weekend, we had a dramatic or exponential growth of numbers or increase of infections in our province during only that weekend of Easter. Even now, we are relatively enjoying the low levels at less than 200 people who have got active cases, and we know what is likely to happen. That's why we are appealing to our people. That's why we are welcoming the interventions by national to say people will remain at alert level 1, but people must behave normally. People must take responsibility. People must protect themselves and protect their families, failing which we will go back. We don't want to experience third wave in the Eastern Cape, because the second wave has actually decimated our people. More than 11,000 our people die. So we don't want to say that families are without mothers and fathers as we speak. So we don't want that, and I don't think families would want to experience that. Here, if you were not infected, you were affected. So third wave can really definitely give us problems. We were told about by this new variant, which was almost a twin. We're not looking forward to see triplets now in third wave. So we must avoid anything that was going to complicate our lives and create problems and more burden in our healthcare system. So far, we are fine. We have got lesser numbers, less than 100 people in hospitals. So we have got less deaths that we're experiencing every day. So everything is under control. We have added beds in our hospitals. We have added oxygen. Almost all our district hospitals have got bulk oxygen now having been installed. So we are almost ready, but you will never be ready 100%. Where the ready becomes relative, even the best healthcare systems in the world collapses because of this COVID. So you don't want to be adventurous and do try and error here. Our people must just help government work together They don't need police to force them. Comply, wear your mask wherever you go, but keep the regulations. In funerals, those numbers must remain limited so that we manage any potential spreader that could really likely to happen post-funerals.
All right. Premier, I want to end our conversation with this final question on politics. Your province, the leadership of the ANC in your province, you were the first to implement the step-aside rule without any hesitation. You are the third biggest ANC province in terms of the numbers to conference. There are worries that there might be those who are going to mobilize around the Secretary General, Ace Magashule, who's expected to step down within the 30-day period. How do you plan to handle those who are going to mobilize, saying Ace Magashule is with us and we're not going to go down without a fight?
The only person who was mandated in terms of his job to speak on the matter is the provincial secretary. But of course, as the provincial leadership of the ANC, we are committed on a renewal project as actually decided by the conference, the 54th National Conference. And we believe that that's the only way to save the ANC and save ANC from us as leaders, save ANC from us as members of the ANC. ANC is an important instrument to change people's lives in our country, and we cannot just play with it. So with all other issues, and we're just simply following what ANC has told us from the conference as basic by implementing the resolution of the conference decisions as outlined. We're following the ANC constitution and nothing more, nothing less. So we don't speak on national issues. National has got its own spokesperson who are mandated to speak on behalf of the ANC. But from the provincial point of view, we have a clarity of mind around the issue of renewal of the ANC. And the renewal of the ANC is not just step aside. It's about that Damascus moment, that all of us, we must change to allow ANC to have another 100 years to come. So we are working towards that particular program for us to advance the national democratic revolution. That's the only way. We need revolutionaries in the ANC. We need selfless leaders. We need people who are prepared to sacrifice for the ANC to survive. We must, all of us, allow ANC to grow by dealing with all the malfeasance. So we've got one ANC. You don't have many ANCs. You can't have other people calling themselves within the ANC and we think that is normal. Oh. That's a truth. So you definitely have to deal with that and actually erode it completely out of the system of the ANC. It can't be allowed that the people are organizing themselves in the different groupings or factions. The lobby groups are allowed free conferences, but if a lobby group still post-exist the conferences, then it becomes a faction. And factions are actually a cancer that we are dealing with, and that's exactly why we talk about renewal. Yeah. People must be members of the ANC, not members of other members. People must be members of the ANC free from other members, regardless who recruited you into the ANC. That's why ANC literature is there to help and guide and develop every member of the ANC who joins. So it's important that we have members of the ANC, not to have members of other members in the ANC.
So, Premier, seeing that you act very tough on corruption, there was the small matter around you having applied for, I think, a master's to be enrolled into a particular university. That some people may interpret it as possibly something that could be a blemish on your name. What actually happened?
I'm getting a person I'm not. I've applied for like any other students, and I followed the process. I was guided by the department concerned, and I submitted what I would have been advised to submit in terms of the recognition of prior learning. And when the university admitted me, I thought that what I've submitted meets their requirements, and the university allowed me to register, and I've been part of that university. Of course, with other 2 years, I've really been active into program because I registered as far back as 2017, but I had some challenges not to be active in the program that I was doing. I've done almost everything. I went to Forte to present to panels and panels of professors. Because the Forte allowed me to do a program through research, not through coursework, so there was no coursework that was done, so no assignments, nothing, as people allege, is out there. So it's a blatant mischief from where I'm seated. It's a violation of my rights as a student, and all what has happened. I've never been called. At least if you are going to be expelled at school, you are at least told to bring your parents, at least if there's something wrong with you. So I've never been given an opportunity for them to come and say, hey man, we see something that is unfamiliar with you here. It's very funny. It's very funny. Now I see other excited people like JJ Tabane, the Kamisa, the Chala, so I'm following proper processes to deal with such elements. I've appealed at Forte to the council. I made a proper submission to the council, appealing as a student. And surely, I feel like I'm treated the way that I'm treated by Forte because it's me. It's me as a premier. If I was just any other ordinary student, it would have not been handled like this. Because if you've got something that you are falling short of, university is always there to create a space to come and make your presentation. So it's a blatant mischief from where I am, but I'm following the process and I'm open to any form of investigation. I've never done anything wrong, and I've never admitted myself. Forte gave me a supervisor, that is their professor, that I found at Forte. When that supervisor was suspended, Forte gave me another supervisor who is also a professor at Forte. I went on with that supervisor to a point where even my ethical clearance application was approved. I was about to start my research now, the survey. So all these issues, I've been doing it above board. So I just don't understand this thing. Where does it come from? Yes, but I understand some really issues that could be existing. But you don't want Forte to be involved in politics out there. Forte must be an academic institution of higher learning, and it must allow students, regardless of their status in the society, to be treated as students, to be given a dignity and respect they deserve. So here I feel like my rights were seriously violated by the university, but I'm following the internal processes of the universities. I'm speaking to my lawyers. I will take this one down to the wire because it's about my integrity. Yes, of course, there are mischievous elements who think that they've got something out of this. And I can tell you, every day people are plotting about me. They're creating all these funny stories, frivolous cases after cases. I'm dealing with that issue because it's me. People are obsessed. There's a really boundless obsession that I'm observing out there. So I'm in that space. It's politics, I understand, but here I must be treated as a student, and Forte understands that. And from where I am, Forte would have said, in your file, there's something that is missing, come back. So you can't just take such arbitrary decision without involving a person concerned. So you can't make an adverse outcome or whatever decision you are making without giving a person a chance to come and explain. That's why I've appealed to the university following proper procedures. I remain a student. I'm not a premier at Forte. I'm a student, and I view myself as that, and I would be comfortable with Forte dealing with me as that. So reading all what I'm saying about what the Vice-Chancellor says about me in the international media space tells me that here the matter is treated quite subjectively. There is no objectivity here. The man is personal. But it's fine. I'm handling that as a student, and but at some point I will have to handle it as a politician.
Sure. All right. Premier Oscar Mabuyane, thank you very much. Very angry man around this issue of his studying at Forte University. Thank you very much, Premier, for your time.